This is going to be a recorded interview in reference to PBSO case number 250444752. Today's date is March 25th, 2025. The current time is 8:14 a.m. My name is Detective Eric Zadnowski, ID number 6531 of the Palm Beach County Sheriff's Office. I'm presently located at Animal Care and Control, located at 7100 Belvedere Road, West Palm Beach, Florida, 33411. Present with me is Dr. Sarah Chapman, who is identified by Animal Care and Control staff. Dr. Chapman is wearing a blue and green sweatshirt and red scrub pants. Dr. Chapman, do you speak English?
Yes.
Okay. Are you under the influence of any medications that would affect your ability to tell the truth, understand the questions I'm about to ask you?
No.
Okay. Do you have any mental conditions or impairments that would affect your ability to answer my questions?
No.
Okay. Can you please state your full name?
Sarah Chapman.
Perfect. Okay. Can you raise your right hand? Do you swear and affirm that the statement you're about to give is the truth?
Yes.
Okay. And do you acknowledge that whoever knowingly provides a false sworn statement under oath shall be guilty of misdemeanor first degree?
Yes.
Okay. All right. That said, this is going to be in reference to a female middle-aged adult pit bull canine named Gypsy that was brought to Animal Care and Control on March 20th, I believe, correct?
Correct.
Okay. So you were presented with Gypsy by Sergeant Sharp?
Correct.
Okay. Can you tell me what your professional what you observed when you treated and what you treated Gypsy for?
Sure. I can talk about my main exam findings first. So Gypsy was a female spayed, middle-aged adult pit bull type dog. She was a normal body condition. She was panting and had increased heart rate. She appeared hydrated and normal mucous membrane color, clear eyes, ears, and nose. But she was non-weight bearing on her left hind limb. Her left hind limb appeared more swollen than the right hind limb, both in the upper section and the lower section of the limb. There was a sock taped to the lower portion of the left hind limb, taped at the level of the left hock. There was obvious swelling visible at the level of the taping. She also had what appeared to be swelling in the right chest region. I did not see bruising associated with that region at the time of my vet exam, though. When we removed the sock, below the sock was a vet wrap-like material and gauze material bandage placed at the level of the paw, the left hind paw. And below that was significant swelling, significant sub-Q bruising. There was a laceration to the medial aspect of the left hind paw that was bleeding. And then there was significant crepitus, which is a crunching feeling from bones rubbing together at the region of that left hind paw. I did not feel significant crepitus on her other limbs when I palpated them in range of motion. And then because of the findings, we sedated her with some sedation to be able to draw blood, remove the bandage, and take x-rays and clean her wound. The x-rays that we got showed significant fractures of her left hind metatarsals. There are 4 metatarsals within the left hind paw, and she had fractured all 4 of them to varying degrees. The metatarsal 2 and 3 were significantly comminuted fractures, which just means they're in significant many parts and had displaced parts of those bones. The metatarsal 4 had about a short oblique fracture that was complete through the metatarsal, and then the metatarsal 5 appeared like it had one side of the bone had a piece chipped out of it. So it seemed like the most significant fracturing was on that medial aspect below the area where that laceration was found.
Okay.
I do have the blood work. We did some blood work. The most significant findings on the blood work would be an elevated creatine kinase, with it being 1,718 units per liter, with the normal range being 10 to 200. So that is a significant elevation.
What is that? What does that usually show?
Creatine kinase would elevate with significant muscle traumas, and it is generally a very quick enzyme, so it'll go up and peak and then kind of come back down within a 24 to 48 hour period. So the fact that it is elevated meant this was a very recent injury from the time that I saw the animal.
Can that be related to like adrenaline and maybe something causing pain?
Definitely think some significant muscle traumas that would cause significant pain, yes, but it's released from actual damage and trauma to the muscle.
Okay.
And then AST is a enzyme that can be from the liver, but in this case, it is likely released from skeletal muscle, because I'm not seeing any other liver enzyme changes. So the fact that the creatine kinase is elevated and the AST is elevated is just showing significant trauma to skeletal muscle.
Okay. And based on the x-rays, are you able to determine that these fractures specifically were caused by blunt trauma?
Yes, these would be caused by blunt force trauma.
Okay. And also as you already articulated, the levels of that, of the blood work came back. And do you, based on your professional opinion, suspect that this dog, Gypsy, was suffering from that blunt force trauma?
Absolutely.
Okay. And anything else that you could add in reference to, obviously dogs feel pain, we know that. We don't know how long she's been, we do because of video surveillance footage and other evidence, but we don't know how long or she's been suffering like this. But based on your professional opinion, do you think that Gypsy is recovering from her injuries right now?
Obviously, I only looked at her on the day that I saw her.
Okay.
I did place a bandage at the time that I saw her while she was sedated to add extra support, because the injuries that she suffered to her left hind paw fractured every weight-bearing bone in the paw that would provide the support that the limb needs to put weight on it. So she's currently in a state where she is unable to put any weight on that foot without causing significant movement of bones and pain every time she puts her foot down. So it's definitely going to be a long road to recovery and cage resting and pain medications to get through it.
When she was first presented to you, did she appear physically like she was in pain? Was she making any noises?
Limping is pain.
Okay.
If you are not putting weight on a limb, it is because it is painful, and you
Okay.
are sheltering that limb from feeling that pain.
Okay. All right. Anything else that you want to add in reference to Gypsy's treatment, or anything related to this case?
I think I've said everything from the findings.
Okay. Typically, in your professional experience, how long of a recovery is something like this? What does it depend?
It's definitely going to take weeks to months. And in my opinion, obviously, it comes down to financially what he decides with the other veterinarian. So I can't 100% speak to what another veterinarian's going to do.
Right.
But, if cage resting and splinting and pain medications is the option, there is still chances that down the line this dog's going to have negative consequences from this injury, whether it be that in the healing process it doesn't heal appropriately, or if it can heal and bridge those gaps from those significant fractures, will she down the line have significant arthritis in that limb or other limbs from using that limb abnormally in the future.
Okay.
I do have concerns about that down the line.
So these could be long-term injuries that are going to affect the
That will
quality
affect
of her
her.
life.
Moving forward, yeah.
Yeah, moving forward. Okay. I think that's all the questions I have. Oh, one other thing as far as medication. She's on pain medicine. She was sedated, you said?
I sedated her and I gave, the sedation, one of the drugs that we use is an opioid involved, so that is pain medication. The dexmedetomidine also covers pain, and then I also added an anti-inflammatory injectable on while she was sedated. We did the bandaging to help with stabilization, and I sent her home with a couple of days of oral anti-inflammatory and medications to help calm her, keep her calmer for resting until he could follow up with another veterinarian.
All right, thank you so much, Dr. Chapman. The time is now 8:25 on the same date, and that'll conclude the interview.
It was confusing.
Sometimes they don't want to shut off.